Those stories in just a few moments, but first tonight at 5 o'clock. On Thursday, Rhode Island and the nation will no longer consider COVID a public health emergency. Good evening, and thanks for joining us tonight. I'm John DeLuca.
And I'm Tiffany Murphy. So this comes 3 years as we transition back to pre-pandemic norms. ABC 6 News reporter Daniel Coates joins us now live from the state's health department with more on this story. Daniel?
John, Tiffany, good evening. The Department of Health told me this afternoon and wanted to remind Rhode Islanders that Thursday certainly isn't the end of COVID-19. New strains could still arise and transmission could rise as well, but it most certainly is a step in the right direction, a step towards normalcy that we haven't seen here in nearly 3 years.
What many are calling the end of a 3-year fight. Rhode Island and the country will no longer consider COVID a public health emergency starting this Thursday. But what does this mean for your day-to-day? Well, for starters, some of the basic resources like free masks, medication, and tests will be harder to get a hold of.
The widespread availability of home-based COVID tests, the self-testing for COVID, those will no longer be as freely available and accessible for free. People will still be able to get them, of course, pharmacies, other places where they can buy them over their counter, but that's one example of where people may have to pay more.
Dr. Philip Chan of the Rhode Island Department of Health says this is by no means the end of COVID, citing low transmission, but a possible return to masking in some areas after the summer.
For vaccines is that those will continue to be free through the state, that we may see a return to masking specifically in healthcare settings and in other settings which care for people that may be more vulnerable to COVID.
Healthcare settings like Care New England's 3 state hospitals, who told employees they could unmask last week and are now gradually expanding access and capacity for guests.
Visiting hours will continue to change. We're not back to pre-pandemic levels, but we are more open than we were during the pandemic. It's really very facility-based due to the different populations we serve. But yes, we do allow visitors now, whereas during the pandemic, we did not. How many visitors, at what time, varies by facility.
Robin Neal, Vice President of Care New England's Quality and Clinical Effectiveness, also warned Southern New England that people are still dying from COVID. But workers and even patients have been overwhelmingly in favor of the return to normalcy.
It was one of the first messages I got back from my staff. Not, oh, we don't have to wear the mask anymore. It was, wow, I can greet my patients with a smile and I can connect with them. They were really happy.
Once again, many regulations and policies remain fluid at this time and will in the next coming weeks. So stick with ABC 6 on air and online for continued coverage. For now in Providence, I'm Daniel Coates, ABC 6 News.